Hi everyone, I'm Andrea with Reliable Beauty Reviews, and today we're going to discuss everything there is to know about Botox. This video is for those that have never tried Botox and are thinking about trying it for the very first time. I've been using Botox since 2008. I've been getting treatments for a very long time, so I understand how to review it, but I'm also an ongoing patient. So if there's any questions that I haven't covered by the end of this video, please put them in the comments section. We'll talk about what it is, the cost of Botox, the risks, as well as many myths we'll uncover. So let's get into it. What is Botox? Botox is the brand name for a purified botulinum toxin type A. It was originally developed to treat medical conditions such as chronic migraines and muscle spasms. Then doctors began noticing in the late 1990s and early 2000s that patients receiving Botox for migraines also experienced relaxed facial muscles and fewer wrinkles. By 2002, the FDA approved Botox for cosmetic use. This discovery has made it one of the most widely used anti-aging treatments for women as well as men. What does Botox feel like? Botox injections can hurt a little bit. The feeling is brief. It's similar to a quick bee sting. The areas that tend to feel most sensitive on my face are above the eyebrows and the top of the forehead. So with that said, many providers may offer an ice pack before treatment to numb the area. And if they don't, definitely ask for one. I find the ice to be very helpful. It lessens the sting of the needle in those sensitive areas. I feel it makes a difference during your Botox treatment. And because I don't like needles, I just close my eyes. I don't like to look at them. I just close my eyes during the entire treatment. And here's a new thing that I've noticed in the past few years. If the doctor can sense you're tense, they typically ask their assistant to gently tap your arm or leg while they're injecting the Botox. This serves as a distraction for your nervous system. It's a good idea. It helps, but to be honest, not a lot. I still feel the needle. Now, after your first treatment, your forehead may feel tight, or you might feel a gentle pressure like I did. The feeling is similar to somebody resting their hand on your forehead. This is very normal, and that feeling fades as you adjust to Botox going forward. What is the recovery time? The good news is there's no downtime, but bruising may occur and it usually fades within a week. Sometimes I get bruising, sometimes I don't. I like to take arnica before and after treatment to reduce bruising and swelling. It's a small little pill that you put under your tongue. You can put 2 or 3 of them under your tongue at a time, and it definitely lessens the bruising. Or you can use concealer, which will always help cover discoloration while it heals. Can Botox change your expressions? So far, we know that Botox works by temporarily blocking nerve signals to muscles, which softens movement. But if too much Botox is injected, it can limit expression and create a frozen appearance. So definitely don't ask for too much. That's all you need to remember. But if you do, it will eventually wear off. I typically receive about 32 units in the forehead, above the eyebrow, and above the nose. 32 units is a standard amount which allows natural movement. I'm still able to raise my eyebrows, but keep in mind, results may vary depending on placement and dosage. Now, when Botox is placed near the mouth, it can affect your smile. Personally, I would avoid injecting around the mouth because it can alter your expression more noticeably. It happened to me once. I got Botox around the mouth, and when I smiled, I couldn't smile as wide as I used to until the Botox wore off. That wasn't too bad, but some results end up with a crooked smile. Another thing to remember is the longer you continue to get Botox over time, many people learn to relax their facial muscles, which helps prevent those deep expression lines. How long does Botox last? Results generally last 3 months. It varies by person. Since I started getting Botox in 2008, I now maintain results for 4 months. So now I only get Botox 3 times a year instead of 4. So pay attention to how long Botox lasts on your face. My dermatologist always tells me to book my appointment every 3 months. No doubt it's for revenue purposes, and since we all know our faces, I can see how long it takes for Botox to wear off on my face. So I do what's best for me. I make my own decision when I want Botox, and if you decide you don't like Botox or you're not comfortable with it, don't continue getting it, and don't let anyone influence you. And pro tip, results develop gradually. Don't expect Botox to go into effect the day you get it. Wrinkles typically soften within a week. I recently saw an influencer on Instagram getting Botox for the very first time. The minute she was injected, she said to her audience, "See, my wrinkles are gone." Well, that's not true, and it's definitely not realistic. Her wrinkles will go away, but most likely within a week. And to be fair, she probably noticed her wrinkle was still there when she got home that day. Are there aftercare instructions? Yes. And if you don't receive them, definitely ask for them. Too many people are in a rush these days, and it's important you know what you need to do. It's very simple. To help Botox settle properly, avoid strenuous exercise, don't lift heavy objects, and avoid lying down. It's important to keep your head elevated for 4 to 8 hours after a Botox treatment. The day I get Botox, as an extra precaution, I prefer to sleep with my head elevated on a pillow that night, but that's optional. And if you're planning a special event, I suggest you schedule Botox a few weeks in advance, especially if you end up getting bruises. The waiver. Before treatment, you'll sign an informed consent form acknowledging you understand the procedure, you are aware of potential side effects, you accept the risks and possible side effects like bruising, headache, or even temporary eyelid drooping. It can happen, but it's rare. So far, that hasn't happened to me. And bear in mind, severe complications are uncommon when Botox is done by trained professionals using proper technique. So choosing an experienced injector, such as a board-certified dermatologist, plastic surgeon, or highly trained registered nurse under medical supervision reduces risk. I highly recommend it. I cannot say that enough. And I don't recommend you go to the nearest med spa for Botox. They're great for any non-invasive facial treatments or for massages, but when it comes to something as serious as injections, especially Botox, make sure you go to someone who is board certified. Cost and dilution awareness. Botox is usually priced per unit, with 32 units being common for the forehead. If prices are $10 to $11 a unit, be very cautious. That usually means they are over-diluting the Botox, which makes it less effective and it will wear off faster. So here's the takeaway. Quality product plus skilled injector equals better results. Botox versus Xyman. What is Xyman? Xyman is another botulinum toxin type A product. It works very similar to Botox, but it lacks an accessory protein found in Botox's formulation. The protein gives the product a longer shelf life. Xyman doesn't have this protein, which is why they tend to call it a naked protein. Some people prefer Xyman, other people prefer Botox. Botox is a little more expensive per unit than Xyman. Xyman's about 10% cheaper per unit. In my experience, Botox lasts longer on me, so I like Botox better. Results do vary per person. Some people metabolize Botox or Xyman faster, so results vary. Can you become immune to Botox? A small percentage of patients, about 1 to 2%, may develop antibodies that reduce effectiveness. This is rare, and it can also occur with Xyman. For most people, Botox continues to work reliably. What is baby Botox? This is relatively new, so it may be a new term for you. Baby Botox refers to using very small amounts or a few units of Botox injected around areas like the mouth or the chin. But keep in mind, these areas are constantly moving, like when you eat, when you talk, or when you drink, so the Botox tends to wear off more quickly. And because the dose is so small and the muscles are very active, results usually last about a month. I've personally tried baby Botox in these areas, and again, it lasted a month. So in my opinion, it's not really worth it unless you have a special event coming up and you want short-term, subtle improvement. The good news is a few units are very inexpensive, so it ultimately comes down to your preference and your goals. Now let's talk about the myths regarding Botox. Myth number 1, Botox is basically poison. The truth is, Botox is a purified medical-grade protein used in tiny, controlled doses. It has a long safety record when administered properly. Myth number 2, you're injecting toxins into your face. The truth is, the word toxin sounds scary, but Botox is a regulated product used in microscopic amounts. A full cosmetic vial contains only a fraction of a milligram of active protein. In these tiny doses, it does not spread through your body or poison your skin. It works locally at the nerve ending to gently reduce muscle contraction. It's similar to many medications that come from substances that could be harmful in large amounts. The key difference is the dose and how doctors use them. So while the word toxin is technically correct from a scientific standpoint, in the context of cosmetic treatments, it's a purified, precisely dosed medication, not a poison harming your face. Myth number 3, Botox isn't FDA approved. The truth is, Botox is FDA approved for cosmetic use. in medical conditions such as chronic migraines and excessive sweating. Myth number 4, Botox isn't safe long term. The truth is, Botox has been used medically for decades. Long-term use has not been linked to systemic health problems when administered correctly. Myth number 5, it can travel to your brain or heart. The truth is, when injected properly, Botox does not speed up or stimulate your heart. It works by relaxing specific muscles where it's injected. It does not act like adrenaline, and in normal cosmetic amounts, it does not increase heart rate in healthy people. And Botox does not cross into the brain when used in standard cosmetic doses either, and it does not act like a stimulant or a mood-altering drug. Myth number 6, Botox builds up in your body. The truth is, Botox does not accumulate. Your body gradually metabolizes it, which is why results fade over time. And that's why we come back for treatments every 3 or 4 months. Myth number 7, it causes cancer. The truth is, there is no credible scientific evidence linking Botox to cancer. So if you ever hear anyone saying that, ignore the comment, it's not true. Myth number 8, it's dangerous to start Botox at a young age. The truth is, age alone isn't the deciding factor. Treatments are based on muscle movement and goals, not a specific birthday. Personally, I think it's more common for people in their 30s or older to get Botox. However, I would consult your doctor before getting it. Myth number 9, you can get botulism from Botox. I have heard that so many times. The truth is, cosmetic Botox is highly purified and used in tiny doses. Botulism poisoning is not a risk when administered by qualified professionals. Myth number 10, Botox will weaken your immune system. The truth is, Botox affects nerve signals to muscles. It does not impact the immune system. So the bottom line is, Botox can be an effective tool when used responsibly. It is a medical treatment, not a casual procedure. So choose a qualified provider, understand the risks, and follow aftercare instructions. Most importantly, do it for you. So I hope that answers all of your questions that you may have about Botox. If you do have any additional ones, please put them in the comments section. And if there's anything else you would like me to review going forward, please let me know as well. I'm Andrea with Reliable Beauty Reviews, and I'll see you on the next one.